Welcome to another episode of Late Nights with Dr.G. You have questions, I have answers. Well, this is our episode 2, and we're really going to get into the kind of the meat of learning about this MAHA movement, Make America Healthy Again. As a physician, I'm very interested in this, and I think you will too. Hey guys, I'm Dr. George Armendariz.
All right. So with that being said, Dr. G, what is in the news lately?
The main thing that kind of is really eating at me is this Make America Healthy Again. Now, eating at me in the sense that as a physician, what I should be doing for my patients, and overall what all of us as physicians, let's say, or, not just physicians, people that are nurses, people that are doing anything medically related to help an individual, okay? So it's not just for physicians, but we focus on physicians just because those are the people that supposedly are the ones taking care of everybody, okay? Now, the main focus with Make America Healthy Again, with RFK and with the Trump administration doing that, is primarily with food additives and allowing our food to be much more healthier than it has been, for, I don't know, decades maybe. I don't know. I kind of went down a rabbit hole, kind of researching some of this stuff, and it's quite interesting because if you think about it, there are always going to be two sides to every story. And some people say, well, you're not doing the proper things that you're supposed to be doing for the American people, as a physician in America. But on the flip side, you always have to think about, what can I do as a physician? I went to school for all these years, all this training. Our main focus is we follow the Hippocratic Oath, do no harm, okay? Now, there's a lot more to that oath than that, but we want to do our very best to make people as healthy as they can be so they can live a lot longer, they can be more mobile, they can just live their life at a better rate, okay? And what's interesting is that with RFK's push for food additives as an example, food additives, okay? We're one of 2 countries that allow these particular additives still in our food system right now, which is crazy to me.
What's the other one?
Okay, I believe it's Canada, but don't quote me on that. But we should not be, and to be fair, Canada's still better than us in that sense because they have banned a lot of these things, but they allow certain things that we obviously still allow. But the crazy thing is that you look at any other country, and I'm talking all of Europe, Russia, all these countries that are so-called bad countries, they have banned a lot of these type of food additives that we're still waiting for our FDA to ban. And they haven't. The EPA has asked to ban certain chemicals. There's been requests for banning these BPAs, these PFEAs. These are all of these alphabet drugs or alphabet chemicals that is, you hear them in the news, TCAs, BPAs, PFAS. These are just, polyphenol acetyl chemicals, things like that. That's what these stand for, these letters. All of these different chemicals that we still allow for different processing of different foods that we use every day. And like in the cereals, that's the red dye number 3. Everybody has always talked about that. Well, it's always in Fruit Loops and it was in Lucky Charms. And these are cereals that, I used to love when I was a kid. But now if you really get into it, you're like, man, those really aren't that good for you. And being that we haven't been able to, or at least our particular organizations haven't banned those particular chemicals, it makes you wonder, is our public policy on this, who is somebody saying, look, why don't you just let these go and, we'll help you if you help us. And so you don't want to play a conspiracy theory like for everything, because then people look at you and say, oh, you're just crazy. but unfortunately, I have to play a conspiracy theory. The theory that I have for all that is that the pharmaceutical companies, I mean, I believe that they are the ones behind a lot of these type of things. Now, it's not just solely them. There are other agencies involved, but for the most part, at least when you're talking about health, pharma companies are the ones that, we would rather push a drug than to push a whole dense whole food diet type of thing and exercise. If you look at old videos from the 60s and then even the 70s and 80s, but mainly the 60s and 70s of kids in high school, you see them doing PE, okay, calisthenics. And if you look at all these kids in the playground or in the school area, they're pretty thin for the most part, okay? And they're doing, you're required. I don't know if you know.
What do you have any idea of the numbers of when obesity started rising in America? What years?
And that's an interesting point. Okay, just for, let's say, 2020, and this is when, because of COVID, a lot of people started really looking at all these percentages and values of why are people dying? What are the chronic illnesses causing our issues? Well, they also went into what are the percentages of people, and by people, not only adults, children too, what's the percentage of them being obese? A crazy point that just kind of baffles my mind is that in 2020 and even now up to 2025, 50% of 12-year-olds in the United States, 50% are either overweight or obese. And the American Academy of Pediatrics, their first line kind of first line of what they're telling doctors to prescribe, what do you think it is? It's tough. Anyway, a lot of people may not know that. It's Ozempic. Really? Is that not crazy? Ozempic.
For 12-year-olds.
Yeah.
So isn't there like the controversy over people using Ozempic but not getting their daily nutrition, and they're losing so much weight so quickly, or losing so many nutrition, like just not getting any nutrition so quickly, they're actually getting major health effects to their body?
And what people, and trust me, I'm not, trying to say that Ozempic is a bad, or those GLP-1s are bad. They're not. For the right people, they are pretty good.
Yeah.
They can be great. I mean, if a person is morbidly obese, if they're diabetic, I think those are wonderful drugs for those type of people. But to think that you would want to focus on giving a child, as an example, first-line therapy is going to be a prescription pad where you're going to be writing these type of drugs. Will it cause them to lose weight? Yeah, it will. But it's also what people don't look at their bone density, look at their loss of muscle. And when you lose weight, it's one thing to lose 4 or 5 pounds in a month, but these people are losing 4 or 5 pounds in a week. And that includes adolescents losing it that fast, especially if they're on the larger side. If you think about that, you have to understand that everything, if you do something, you're going to have an ending that it has its benefits, but there's always going to be down.
Yeah.
There's going to be downward kind of points that are going to hurt you. Mm-hmm. And so a lot of people on Ozempic, whether they're an adolescent or if they're an adult, the main issue is that you lose too much muscle. Okay. And when you lose too much muscle, your bones get a little bit weaker. And when all of that happens and you're used to doing this and you do this day in and day out and, for years even, it's going to cause you to have major repercussions in your metabolic health. Mm. And so that's one thing that, as I kind of went down that rabbit hole as a physician, I think that we have to get a hold of that. And so, like him or not, the points that RFK is trying to make with that MAHA movement, that Make America Healthy Again, those are pretty damn good points. Mm. I was listening to some of his podcasts that he has, and when he was running for president against Trump, his particular advisors were Casey Means and Kerry Means. Well, Casey Means is now the nominee for the Surgeon General of the United States, which is quite impressive. Callie Means is the brother of her. And so he runs a company called TrueMed, okay? And this company is trying to, kind of through public policy, is trying to get the powers that be, whether that's the FDA, more so it's just Congress, to pass bills so that it would allow us to, let's say, make the food that people can purchase with food stamps or SNAP, or there's a lot of different programs out there, that it will be healthier food. Like right now, you can buy Coca-Cola with that.
Yeah.
You can buy all of these cereals with
Little
with
Debbie
all this
snacks.
Little Debbie snacks. The what is it? All of the great tasting cereals. I mean, those they taste great. Not that good for you. Okay. And so, they're just kind of trying to get that to change that. And so one of the points that he brings up is that, and this was kind of surprising to me, is that the IRS, okay, where you're like, wait a minute, I thought we were talking about medicine. The IRS came in and had a particular, I don't know if it was some type of news story or something to that effect, stating that food is not medicine. And I'm like, who in the hell from the IRS knows what is medicine or not?
Yeah.
And it just, and I was like, what is this about? Well, the point of them bringing that up is because with his company, and it's not just with his company, this has been going on, and a lot of people know this, that if a doctor writes you a prescription, if you come to me and you're like, I'm not feeling great and this and that, maybe I need to take some type of medication. I go, no, I'm going to write you a prescription for a gym. I want you to go to a different gym. This gym's a lot better. And I'm going to write you a prescription for a protocol, let's say a keto type protocol for your diet, help you lose weight. But if I write that down and I give it to you, that's tax deductible. You can use that dollar for dollar with an FSA or FHA, those kind of HSA, excuse me. Anyway, and you can utilize that, and so you can write a lot of this stuff off. And that includes supplements. That includes pretty much everything. If I write a prescription for you as a doctor, you can write that off, okay? Too many people are doing that nowadays. And so they came out and said, well, food is not medicine, because these doctors are writing these diets in which they want people to start trying to get, more whole foods in their diet.
They're trying to categorize it so that they don't,
And who is it, or can you tell me, who is it that said, let thy food be thy medicine and medicine be thy food?
The Dirt Facts, Dr.
That was a guy that's near and dear to my heart, especially for a physician. It's Hippocrates. Hippocrates said that. And then when
David Buss was another one that also said something. Dr. David Buss said something else.
And there's a lot of these biohackers. There's a lot of these guys that not all of them are physicians or medical type people, but for the most part, especially nutritionists. Yeah. Nutritionists know a lot more than we give them credit for, And what I probably studied nutrition maybe 1 hour, maybe 2, my whole medical school training, and which is kind of sad, And so points like that you're looking at the IRS saying, well, food's not medicine, so you can't write that off, in which we've grown with those kind of teachings that food is medicine. If you eat the right food, and if you eat the bad type of food, you're going to get sick. And so what do we have? We have all these metabolic issues and chronic diseases that sadly are what cause probably more than 85% of all the funding that we get. That, you're talking insurance, you're talking Medicaid, you're talking Medicare, everything is because people they're just sick. And these, like all of these particular illnesses, and they can be prevented with proper food, proper exercise, just diet and exercise. Now, granted, I can't say that everybody's going to do it, because people have, it's easy for me to be up here and, you got to do this, you got to do that, but, I don't know their life. I don't know what's going on in their life, but people have to kind of take responsibility for their own situation and try to get themselves better. And I think something simple like eating a better diet, not eating ultra processed foods, drinking more water than even if you want, a sugary drink, why don't you have iced tea with sugar in it? Yeah, it's not that good, but it's better than liquid sugar. Yeah. And don't get me wrong, I like a good Coke or a Pepsi, but it's one thing to have it occasionally, but it's a whole other if you're drinking that on a daily basis. And I include these diet Coke or diet Pepsi or whatever else you drink.
So could you still write, and did they change the rule, or what happened with that?
No, it's just that the reason they said that is because more and more people, they're noticing a trend over the last, I think it's like 5 years, they're noticing a trend of more and more people utilizing that, asking their doctor, can you write me a prescription for this? Either the sad thing is I think people are asking the doctor to write that. Now, maybe it's financially, they're only doing it for a financial type of thing, but I would hope that the doctor is saying, I'm going to write you a prescription for this. Then, which I know that they don't. Majority of them don't. Doctors our hands are tied to what the insurance companies allow us to do. Now for the type of medicine that I practice right now, a lot of that's more cash based, or retail medicine, and so I don't have to worry about that as much. But still, as a anesthesiologist and a pain management physician, I'm still, my hands are tied depending on the particular insurances that we're working with. So, it affects me too, just not as bad. I've kind of situated that so that I'm not, governed by insurance companies so much, but a lot of doctors are, and I can't blame them for doing or not doing certain things that we know is better for that patient. And I think it has to change at that level. It's just, if you're a family doctor or an internal medicine doctor and you're getting paid, you have an overhead from your clinic, you're getting paid by these insurance companies to do certain things, you got to still provide for your own family.
I heard that also private medicine, and a lot of people are going that direction. Are there better options nowadays for private networks and stuff? And what do you suggest?
Well, right now, functional medicine is a real big topic, and then of course the longevity medicine. I can't think of the exact, because now it used to be family medicine, internal medicine, general surgery. Pediatrics, now they have some very, very specific type of specialties. Now, obviously, there's not necessarily boards for those or boards that the American Board of Medical Specialties, conforms. Okay, that board is a real board, but it's still additional training in certain areas like functional medicine, as an example, that can really help people choose to be healthier.
Aren't there also private? I don't know. It's like PPO or they have those private ones.
You have HMOs, and you have PPOs for the most part. Now you have self-insurers, and you have MCOs, you have self-pay programs, you have peer pay programs.
But don't they have independent now that you?
Well, you can do that, and more and more people are utilizing the HSA type of I guess
health
ways
plan.
of paying for their
but
anything that for the medicine.
Yeah, but you have to have a HSA.
You have to. You have to make it up,
and it has to be through usually a corporate health plan.
Yeah, usually. Yeah. Now for me, I don't have, I'm not part of a big hospital or anything like that. And so, but anybody can do it. You can, Charles Schwab, you can easily get an HSA, but you have to have a certain amount of money to put into that. And some people have that, some people don't, so that is a problem.
But it's tax-free.
But it is tax-free money.
Yeah.
It's tax-free.
And you can take it, I think after a certain age, you can take it out even as I think you're allowed to take some of it.
Yeah, you can
as a retirement.
After when you're after 51, you can take it. After 51, 55, and 59 and a half. 59 and a half, you can take it all if you want to. And it depends. You can't take it Totally
I
off.
used to sell health insurance plans.
Yeah.
That's how I know some.
Well, it's interesting that you say that. These things are pretty important, and those guys, they kind of know their stuff. I.e., Gary Brecka.
Yeah.
He was an actuary that he could tell people down to the month, if they continue doing certain things and living their life how they're going to die, when you're 72.
Yeah.
In April.
Like what happened with Dana White? They said that
exactly
Dana White lost a bunch of
And so that's and rightfully so. He's gotten very, very popular because he's just saying, look, you got to change. You got to change your ways. If you want to live longer and you want to live not just a longer lifespan where you have a longer life, but a health span, meaning you're in good health for a very, very long time. I mean, you got to start doing these things. Now, I get it with a lot of people. They think, well, gosh, do I have to worry about microplastics? Do I have to not drink? Being red light. And hey, I get it. Like, some of them, you're like, well, man, I can't do anything. I can't even leave my house.
Yeah, don't eat fruit. Don't do this.
Don't do that.
Yeah.
Make sure it's organic. And frankly, that's just most people can't do that. I mean, but I think that being out there, everybody can work out. Even if it's only for 10 minutes, and even if it's in front of your TV, if you want to watch TV, sit there, doing some burpees or push-ups or sit-ups or something. You can still watch your show. Will it hurt you to drink a little bit more water than drink a Coke, or some type of soft drink? There's a lot of little things that people can do, and so take a cold shower. That you can't afford a cold plunge. Take a cold shower. I don't know if you've taken a cold shower, but it can get pretty sensitive there. Okay.
I took actually a food sensitivity test and a gut biome test, and I found out some food sensitivities, mainly glutathione and glutamine, not glutamine, gluten, like gluten, and then all the names under gluten that they have, like glutathione.
No, there's so many.
And then
those are all those chemical names.
And then I took the gut biome, and then it turns out that I have high zonulin. So it was supposed to be because of that I have leaky gut.
Oh wow. Okay.
So and then I don't know how serious that is, but then they said that certain food passes through your cellular wall, and then it can essentially not poison, but poison the blood a little bit.
Well, the metabolites from food, especially food that's processed, those metabolites are very toxic. And if they pass through the cellular structure of your intestines, and especially whether it's your small bowel or it's your colon, your large bowel, in your colon, especially your terminal colon, that's where you get all your vitamins are absorbed. And so if you have processed foods, or if you can't, let's say you can't
eating very carefully.
Yeah, you can't metabolize those. You're going to run into problems eventually. Not maybe initially.
It's just really sensitive, quick inflammation, more exhaustion, and then also too, if I don't do something about it in the next 20 years, I could risk. It says I could risk developing autoimmune disease. Yeah. Like that's the main red flag or whatever.
Growing up in the 70s and 80s, we didn't know anything about that. You know why? Because nobody had stuff like that. Like I knew of, when I was in elementary school and junior high and even in high school.
That's when they had like diabetes or not diabetes,
You knew about the fat kids. You're like, oh yeah, that's a fat kid. And there's like one or two of them. Nobody was overweight.
Yeah.
Okay. And then, you knew about the one or two people that had peanut allergies. Okay. Because nobody had peanut allergies. Now it's like, who doesn't have an allergy? And it's just, you try to eat and you try to eat the best food you possibly can, but unfortunately some of the best foods that we have aren't that good. they just aren't. And I remember even like say food stamps, I brought that up earlier. The food stamps back in the day, and the reason I say that is because, hey, my family, we were on food stamps for a period of time. Okay. And growing up, we could get eggs, milk, bread, flour, rice, beans. Okay. The cereal you could get, cornflakes. That's it. Just cornflakes, and not the cornflakes that you post Toasties. cornflakes, it just says cornflakes.
Yeah.
Okay. It's usually in white boxes. Okay. And so, but the point of that, people always talk, oh, the government cheese, government ice cream, but it was real ice cream. It was real cheese. And I'm sure there were some chemicals in there that weren't that good, but for the most part, it was pretty basic food that you would think a food should be. We couldn't get Coke. I couldn't get chips. I couldn't get, what would you say, Little Debbie's?
Yeah.
Or,
That's what everybody gets at the gas station.
I know. And you couldn't get that. And that was that was from probably the mid 70s till probably the mid 80s. And then that's when things started kind of changing toward the latter part where these government funded programs, were changing toward doing, and I don't know why. I don't know why. I mean, you always want to blame the pharma companies, and yeah, they're to blame for a lot of stuff
in general, right?
But
Big Food had their contracts.
Yeah, and but around the 80s is when farmers started having issues with getting loans, and or they weren't subsidized by the government like they were in the past. And so what happened? They went bankrupt. They lost their farms, and those farms, I don't know what happened to those lands. And so we weren't able to produce the foods that we had done for so many decades before. And so what we do, we become reliant on other countries sending us foods, that aren't maybe the best foods, or you have to, put certain chemicals in these foods so that they don't spoil, and it's a roller coaster. That's what I'm saying. You can go down a rabbit hole.
There was also like a whole byproducts industry that became a lot of these additives that are now being removed today. Like aren't some of these additives and some of these like some of the chemicals that are in foods today, aren't they a byproduct industry, like where they decided that some process had a waste material, but they're like, wait, we could use this for X dye color or X, rubber to make the, whatever, the bread more rubbery. Certain things that I've heard about over the years. I don't know what's.
I'm not as I know exactly what you're talking about, and they have found, because you're thinking about you want to utilize
like oil. Isn't vegetable oil or whatever, one of them was originally a byproduct.
Is a byproduct, something that you would throw away,
yeah.
But then they found a use for it. Yeah. And unfortunately, the use is to either treat a particular, food to process it so it lasts longer, or you can make it and you can use less of the real food and more of this processed byproduct, and you have more stuff to sell that lasts forever. If you're
like a McDonald's burger.
I know you've seen that, which is kind of crazy.
They leave them out for like.
They leave them out, and then there was another one that I saw. I think I saw it on Instagram where he put a flame, like a flame.
Oh yeah,
thing
yeah,
to
it won't burn.
And that thing just would not.
They put lava on it.
It was crazy. It was crazy.
I think, but some of those also have to do with the like the way that fire works and the way that I think it's also
also their point with that is the chemicals on those particular bonds. They preserve the food, but they don't burn like they should burn. They will eventually burn, but they don't burn like they're supposed to, and it's because of those chemicals.
Yeah, because
you can imagine
when you eat McDonald's, you feel it for like 2 or 3 days. It is a little tough.
When I was younger, I could eat a lot. Now I can't do that because it'll upset my stomach. And that maybe
I just go to In-N-Out instead.
Because I'm just old. I don't know. But yeah, you're exactly right. I like In-N-Out. In-N-Out looks it's a little bit more fresher. Okay. But no, and all of those points, we all want to point the finger, whether you're on the red side or the blue side or whatever. You want to point the finger at somebody. And it's unfortunate that most of us need to just kind of look in the mirror and make the decision for ourselves to be healthier. And I think, and as a physician, we morally have to think about the prescriptions that we write for patients, so that, especially if you're like a family doctor or you're an internal medicine doctor or a doctor that follows, or a pediatrician that follows these patients for a number of years, you really have to think about, what can I do? It may be a small thing, but what can I do to help this person become more healthy? Is it writing a prescription? Which unfortunately some of them need it. But on the flip side, if you can start them by changing certain actions that they're used to, instead of drinking Coke, switch to Kool-Aid. Okay, Kool-Aid has chemicals in it, but it's mostly water. I'd rather you do that and not have so much sugar, and then we slowly get you down to where you're just drinking water, or milk or something to that effect. Something that your body recognizes, and if you can get, these organic foods, and that's great. It's unfortunate that the healthiest foods are the most expensive, that's. I mean, we should be ashamed of ourselves for that, and there's nothing everybody can get on their soapbox and bitch and moan about that kind of thing, but changing that kind of policy, it goes way up, and I think getting back to talking about RFK, I think he wants to do that as much as he can. His family is a very political family, and his uncle, who was president in the 60s, he wanted to change a lot of things, and he did change a lot of things. Unfortunately, that was cut short. But I think he wants to continue that and try to get us to kind of do the right things, not only for us. We're old. I'm talking about for our kids. And I think that's probably more important than anything else. And that's why, I take offense to a lot of these programs, and even the American Academy of Pediatrics, why, they allow certain things, or why they want you to take certain drugs for these kids. Yeah, they're overweight. Well, how about you just have that kid go out and run? I remember when we were younger, and I know the world is a different place, but we would leave, in the daytime, and mom's like, when it gets dark, come back in. But I don't want to see you at the house. I want to see you in the house. Now, granted, there wasn't that many video games, and they were just starting. We had Atari, and our video games were vastly different than what's out there now. But the point I'm making is that simple improving a diet somewhat and just getting kids out there, running around. I think that does a lot more for them than taking a drug.
I've actually seen a crazy amount of businesses that a lot of these companies doing this, producing Ozempic or manufacturing Ozempic, are based out of Australia, actually.
Now, Ozempic is the brand name for
GLP.
Semaglutide. But there's tirzepatide, there's retatrutide.
Which was a generic, or are they all?
Those when you see here tirzepatide or retatrutide, semaglutide, all those are the generic names. Then you have Wegovy, Mounjaro, Ozempic. Those are the brand names. Either way, now you can have a lot of compounding pharmacies can make those. It's not very difficult to make these.
They've scaled up
because all they are peptides.
Yeah,
they're just peptides, and so they're easily made. And now, obviously, for morbidly obese or obese patients, people that are diabetics, I think these have been great for these people. I mean, because they need those type of things. They need some help with that. Now, I do think that some of the other ones, like retatrutide as an example, that's a 3-receptor type of drug, and it's on the GLP, glucagon-like peptide, the GIP, glucagon inflammatory peptide, but it also hits on glucagon, the glucagon receptor. And the beauty with that is that when glucagon is up, insulin has to be down. When insulin's up, glucagon's down. So you don't want your insulin up high. You always want your insulin down low. It's going to get high for a few minutes, or depending on what you eat, but it's going to come right back down. Your glucagon goes up. Okay. The interesting point about that is that everybody thinks, well, what does insulin do? Insulin, you think, oh, it's bring your blood sugar down. That's not what it does. Insulin blocks all other energy properties so that you can't use fat. Your liver, you have about 20 minutes worth of glucose in there, glycogen. And then after that, what happens if you're on a constant insulin high? Your body gets any food, it puts it right into fat. but it doesn't allow you to burn that fat that it puts in there. And so what happens? You get bigger and bigger. Insulin sensitivity to that, and so that's type 2 diabetes. And so if your glucagon is up higher, your insulin's going to be lower, which is kind of good, because what's going to happen is it's going to allow you to burn that fat. And so what's going to happen? You're going to get skinnier, which is a good thing. It really is a good thing. The problem is that the psychosomatic issues with GLPs, it causes you, and this is what they're finding, which it's great. It doesn't allow you to, let's say if you're a gambler or an alcoholic or a drug user, it gets you to, or smoker, it gets you to not want to do those things, which that's a good thing, right? But the problem is you don't want to do anything. And so eventually you're just there. And so, you're skinny, but you don't want to do anything. And so for certain people, that might be a good thing for them. But for the whole mass of people, and you have everybody on these, even at a low amount, you're gonna start running into problems, And then you don't want to work out. You're losing weight, but you don't want to work out. Well, what's going to happen is you're going to lose all this muscle, and your bone density is going to go, down the chute, and so you're actually going to become weaker. And as you age or continue taking this medication, it's going to be detrimental for your body. And so those drugs are great for certain people. And even if you want to take those for a short amount of time to get yourself in a mode to eat a little bit better, because you don't want to eat on them, but you don't want to do anything, which is kind of crazy, then I think that's okay. But if you just take them, consistently, and especially if you start, I don't think kids should be on them unless they're just really, really big. And then you got to figure out, well, why are they really, really big? Don't just put them on a drug and that they have to take a daily shot or a weekly shot or something like that. It's just not worth it when diet and exercise can do the same thing, and you teach better principles to those people.
So what do you think is happening with people who are like experiencing vision loss, or like a couple of other medical issues with Ozempic? Is it because they're just losing too much weight too quickly?
Well, that could be it. I mean, there's a variety of different things. And then just because we know what it is, doesn't mean we know what effect it's going to have, like every effect that it's going to have. And frankly, a lot of people are on different drugs, and those different drugs may affect that drug differently. You can have a synergistic effect, or you can have a contraindicative effect that, you're using this drug to do one thing, and then it's going to cause this drug to do something else. So you have to be careful with them. And I think that's a problem with just taking these, because you see them on TV, Lord knows, like I said about us, and I believe it was Canada about or it may have been Israel. I just can't remember which one was, but unfortunately we're one of the two that allows us to show these, sell all these drugs on TV, like Skyrizi. I don't even know what the hell Skyrizi is, but yet I have that jingle in the back of my head. Okay. Do you know what I'm talking about?
I don't even know. I don't watch TV though.
Okay, well, see, that's good. I do, because there are certain shows that I really, really like. Yeah. Okay, but once again, even streaming, I don't have cable. Even streaming, they still come up.
Yeah, that's true.
And obviously, they pay a lot of money to these streaming companies to show their stuff, and so it's just funny. We joke about it, but I remember that, and you don't even know what that drug does. But yet you remember.
Well,
I
know they all say at the end, like, risk of injury.
I know, that's the funniest thing.
Blindness, paralysis, death.
Don't take this drug unless you're allergic to it. And if you breathe, don't take this drug. You're like, wait.
Yeah, like one in 1,000 will end up paralyzed.
It's crazy, and you're like, did they say 1 in 3? Wait a minute.
Well, it does.
But it goes so fast. It's so small.
Some of them are like 20% of people deal with like nausea and this. And,
I know.
Like,
and
dude,
that's like the same thing, like the GLPs, the effects, the side effects like nausea and vomiting. You have a gastroparesis, which is just it kind of stuns your GI tract, and it kind of,
a lot of them do that.
Yeah, and it kind of they just stops working very well. You know, and a lot of people are like, well, gosh, now I'm kind of constipated.
Yeah,
and so you have to take a drug for that, or God forbid you drink more water. And some people, don't want to do that because what does that drug do? It makes you not that thirsty also, which is kind of crazy. And it doesn't do that to everybody, but it does do that. And so that's a factor in there. And so that's why I think that we dramatize all this stuff and we're like, man, it's so, it's so good. It's so this. And yeah, they tell you about the wins from these people that were super sick or super big or whatever. And they did so much better. Yeah, they did, because they're the type of patient that needs to be on this. If you're like 15, 20 pounds overweight, you're not the patient that should be on this drug.
Yeah.
What you need to do is get off your ass and start running, put down those donuts and get out there and get your heart beating a little bit.
So when it comes to using like a GLP, like even people who want to use it to lose weight, like what's the ideal, like who should use it then?
Yeah, that's the thing. GLPs should be strictly for patients that, and this is my opinion, but I am a medical professional, so I can say this, that, I think it should just be for patients that are overweight, obese, that are diabetic, and those type of patients that have issues with those type of things. Those are the ones. That's why those type of drugs were made. Now, they're finding out that there's a lot of other benefits. And so in doing that, it also allows some of those benefits. You can take this drug and take it in a microdose. And so you're taking far less than what you would see from, a person taking Ozempic or tirzepatide or Wegovy and all those drugs. And so is that okay? Maybe. I don't know it enough to say that. Now, what I do know about the retatrutide, that's the kind of the one that's coming out. It's not quite out yet, but it's coming out.
There's a new one now?
Mm-hmm. And that one that's the one that hits on those 3 receptors. That one, at microdose levels, can do some really cool things for certain people. And so that may be a benefit, and it may open up that realm of who can take it or who should take it.
Do you know what is it supposed to do, or what's that one?
Well, it can stabilize you, because you're doing a microdose. It's not going to totally freeze everything and cause you to not, eat what you're supposed to, not drink water. Can it? Yes. Will it? Well, if it's taken properly and in a microdose, it can help. And then, one of the things for that particular drug is for postmenopausal symptoms. It has shown that it kind of really helps a lot of these people that have those issues or those side effects. And so that's a definite win, And so I think you should use that if it can help you but not to a point to where this drug, you have to take it every day or every week.
Yeah.
Because retatrutide, you take it once a week. Okay. These drugs are like human growth hormone or like any type of peptide. You should do it, maybe for 6 weeks, 8 weeks. And then you go on a drug holiday, and then you don't do it. Let your body get back to where it was. Then if you have to do it again, you can do it again. But the main goal is to put you in a position to where you can control either how much you eat. You can control
That's
your
like the
weight.
whole idea of supplements.
That's the whole thing about medicine.
Supplements are supposed to supplement your diet, not replace your diet. So if you take too many meal replacement, whatever, and you don't get your full nutrition, you're not getting the nutrition properly, and 2, you're not actually getting the benefit of
No, and you're taking too much of that, and a lot of those, even the
and
good
they can
ones,
wear away your stomach lining or mess up your liver.
They do a lot of things to
One
you,
thing I have been doing though is I've been looking at. I'm kind of an experimental person. I go on ChatGPT and I ask it about Chinese medicine, and then I go on Amazon and then I buy Chinese medicine and I microdose Chinese medicine pills.
Like what
Like
kind of
it'll
Chinese?
just be stuff like feng shui, shuing, peon. Like peon means pills, so I'll get like I have one that's called like Zhu Lang Shi Peon, and I take and there's these little ones, like one is for. They say like one is cool, one is warm. Like one's the warming of the body, one's the cooling of the body. One's like the liver. It's called liver fire clear. One's called liver fire clear or whatever. And so I like take small amounts of his face.
I can, as a physician, I cannot acknowledge that any of these things are real.
But I just try it because when I was younger, I went to an actual Chinese medicine doctor, and I had like really bad stomach problems. He gave me some herbs, and I took it for like a month, and it fixed my stomach like for a long time. Like,
that's Eastern medicine has been around longer than Western medicine, and yeah, do I think that there are some certain things that can work? Yeah,
but I don't know how much. That's the
thing.
Part, so.
It might be a box of chocolates. You ain't know what you're gonna get. Okay.
Yeah.
So it just depends on what it is. Who's making it? How real is it? Is it just a filler? Is it a sugar pill?
Yeah.
Or is it actual an herb that can do the things that it says it should do? Just be careful with that.
Yeah.
But to be fair, the FDA or the FDA, they don't call them the FDA in China. It's called something else. It used to be very, very weak, and people were like, oh, you don't want to get anything from China. You're going to die. Their FDA now, they do a lot. And I would argue that their FDA cater to their people better than our FDA does. Okay? And so because third parties can't affect what their FDA, because it's run by the government.
You can buy this stuff in the U.S.
No, I know you can. And it's just that back in the day, people are like, oh, you don't want to get anything from China. It's not made well, or you don't know what you're getting. Nowadays, it's a lot better. And so I'm not going to, throw some bad on them and say, that's not good. Don't be doing none of that.
Yeah.
Though I do have to tell you, man, if you're taking something called Shin Shai, if you can't pronounce it, I don't know if you should be. I would go to my friend that speaks Chinese and go, man, you got to tell me what this is.
Yeah. Well, I mean, when it turns out it's like this root and this root, and they mix the root and they make it into a blend. Because you could buy all of them separate, but then you'd have to spend like $300.
Yeah.
But then they have one that's like, this is like the digestive Everclear blend and the whatever.
Well, they use natural remedies and herbs.
It's like
more than we do.
They said one of them's like licorice root.
Yeah.
And I forgot, it's like ginger root or something. Yep. Like it has all these little, things.
And all of those, and that's once again, that's more natural type of substances.
I asked ChatGPT, how much can I take? Like, can I be safe? Like, what should I take? And
yeah, no, that's good, because
I don't try to mix too much.
Licorice root, you take too much of that, that's going to kill you. Yeah. So you have to be careful with that. But though all those things are fine, and at least
kill you, really, honestly.
Well, licorice can. It depends on what type of licorice it is. It can.
I mean, all this stuff.
It can be. Its metabolite can be very, very toxic to you.
Yeah.
Depending on how much you take and which one you take. But all those things, I wish more people would look at more natural ways of helping themselves, whether that's medically helping themselves or just health wise, just trying to be healthier. And I think that's very, very important. Now with Google, and now with the Chat GPTs and the Gronks and all these AI.
Actually, we'll have to talk about it the next time. But
I definitely want to talk about AI. I'm taking a class on the fundamentals of healthcare with AI, and so it's very interesting. It's very, very interesting.
It'll be good with like analyzing blood level results.
Exactly,
and stuff,
biomarkers.
It'll be good for that stuff.
Genetics, everything.
Because it'll just process the results faster.
Oh, absolutely.
So then you can take it with your expertise, knowledge. But there was a radiologist, I saw a video. The guy said, it took me 20 years
to learn that.
How to.
I saw the exact same one.
And then he said, now
within about 5 seconds,
it goes.
It found it.
Boom. Yeah.
Radiologists need to worry, because general radiologists, not interventional radiologists. Yeah. We don't have robots quite yet that can do what interventional radiologists can do.
But within the next 5 years,
yeah, they're going to be able to
take scans, X-ray,
any scan, MRI, CAT scans, ultrasounds, anything.
And do it better than actually.
Yep. And faster. And it's sad to say, because it continues to learn. It slowly, everything. And if it makes a mistake, it learns from that mistake. It truly learns from that mistake.
And honestly, people give it too much credit right now. It makes a lot of mistakes. But I think in the next 5-10 years, all the kinks will be worked out.
And the thing is, it's going to be able to find the kinks within itself. That's where it gets kind of scary with that kind
Well,
of thing.
now they're saying there's one, I don't know if this is true. They always spread these rumors, but one of them decided it didn't want to listen, and now it's starting to like rebel.
Well, that
I
has
don't
happened.
know.
No, it's kind of crazy.
It happens once in a while, like
No.
once every million trials.
In Korea and in Japan, they do a lot of every place is doing it, but they've been utilizing AI for probably a little bit longer than we have, at least where we know publicly that they have been.
They have to like tiptoe around the guardrails.
Well,
And
they've had computers, two distinct computers, develop a language to talk within themselves, and the programmers didn't know what language they were talking.
Yeah.
So they shut them down. So that's incredible because those weren't those were standard supercomputers. They weren't AI computers, and God forbid they weren't quantum computers. Those are out there.
Yeah.
And once we really get that going,
or
it's
just
going to
one,
process
or
as
just
fast.
one crazy Russian or something hacker just wants to.
It's gonna we're in the Wild West right now with AI.
It's pretty crazy.
Yeah.
Something bad, some black hat event's gonna happen.
Something I don't know.
COVID, whatever, 19 said it's gonna be COVID 25.
Hopefully not. Then
It's
I'm
like
thinking
something crazy. Just instead of that world,
Welcome to another episode of Late Nights with Dr. G. You have questions, I have answers. Well, on today's episode, we talked about the MAHA movement, making America healthy again. We want to really kind of figure out what do we need to do to make us healthy, okay? As a physician, I always want my patients to be as healthy as they possibly can be, but sometimes my hands are tied. I think everybody needs to focus on what they need to do individually and look themselves in the mirror and say, you know what, maybe I should do this, maybe I should do that. But there are a lot of ways that you can make yourself healthy, you can be a healthier individual, and you can do the right things to, just get out there and not be used to taking just medications and sitting around and not doing much. You got to kind of think for yourself for that. Additionally, we also talked about the advent of all of these GLP drugs like Ozempic, tirzepatide. These kind of drugs, while they're great drugs and they do help a lot of people, I think there's some misuse going on. And so we kind of delve into that and kind of figure out what we should do, what we shouldn't do. And, there's a lot of other drugs on the horizon. So you got to think about what you put into your system.